Welcome to the Medical Dialogues. I am Dr. BP Rahul, a senior consultant at Sanjeevan Hospital, and today I will be discussing about how patients on direct oral anticoagulants have minimal risk of delayed intracranial hemorrhage after low energy blunt head trauma. For individuals on direct oral anticoagulants, the risk of delayed intracranial hemorrhage following low-intensity blunt head trauma is minimal, and the chance of clinically significant bleed is much lower, says an article published in Journal of American College of Surgeons. Delayed intracranial hemorrhage following the negative first head scan is a known consequence of physical trauma, although the risk of syndrome is unclear. There is a lack of consensus about the necessity for the further observation or routine repeat head CT in patients on direct oral anticoagulants due to the possible increased risk and difficulty to assess the degree of anticoagulation. As a result, Thaddeus J. Puzio and colleagues anticipated that patients using oral anticoagulants would have a low incidence of delayed intracranial hemorrhage following blunt head trauma. A medical librarian did an electronic literature search of Ambay's, Medline, and Cochrane library in June 2020 using a mix of keywords and subject headings. Databases were searched from their establishment till June 2020. The included studies reported on the outcomes of the trauma patients over the age of 18 who were undertaking anticoagulants and were monitored after an initial normal head CT. A random effect of model was used in a meta-analysis. The Newcastle-Ottawa scale was used in meta-analysis to assess the quality of non-randomized research. The key findings of this study are as follows. The computerized search yielded 5,719 publications, of which 72 received a complete review and 12 fulfilled final inclusion or exclusion criteria after duplicates were removed. 4,891, that is 92% of the 5,289 patients, sustained a ground level fall. 4 studies reported regular repeat CT scans on all patients, while the remaining studies only reported symptoms-related repeat CT scans. In all, 5,289 individuals investigated, with 1,263, that is 23.9%, taking an direct oral anticoagulants, 69 patients, 25 on direct oral anticoagulants and 44 on warfarin, experienced delayed cerebral bleeding. The pool weight proportion of delayed intracranial hemorrhage on direct oral anticoagulant was 2.43%, while warfarin had a rate of 2.31%. 86% of the patients who experienced delayed intracranial hemorrhage had no clinical implications, but 0.16% of those on direct oral anticoagulants and 0.48% of those on warfarin died as a result of problems caused by the delayed intracranial hemorrhage. Overall, crude risk of mortality from delayed intracranial hemorrhage while using direct oral anticoagulants or warfarin was 0.36%. In conclusion, routinely watching or systematically repeating head CT in patients on direct oral anticoagulants following low energy blunt head trauma with initially negative head CT may not be needed. Thank you and stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.